So we're going to roll right on to introduce Jenny Ahlstrom from HealthTree Foundation.
So just as a little bit of background, I am a multiple myeloma patient who was diagnosed. Can you see my slides? Are they coming across okay?
They're coming across great.
Okay, great. So I'm a multiple myeloma patient. I was diagnosed in 2010 and came from an entrepreneurship background. My husband's an investor and entrepreneur, venture capitalist and private equity. And so we looked at everything kind of like a startup. We looked at my disease like a startup and decided to use our software and technology skills. I had also come from IBM as a systems engineer to help cure diseases in a faster way. So what you're going to hear today is a little bit of a blend of software tools, patient advocacy, but then also its capability to involve patients in the research process. And that's really what we're all about. We support patient communities with tech-enabled services to improve patient outcomes. Everything that we have built, we started out with third-party software, but everything we built for the patient community came out of need, basically, of what I wanted as a patient, what I saw other patients needing to be able to both navigate their disease, but also, interestingly, to contribute to research. And really, the tools have never been provided to patients to participate in that research process. So the first thing we do is that we build community. And interestingly, there are software tools for each of these individually that are out there. Like, for example, we host a news or content management site. We have a community events site where we can host and register live meetings and webinars. We host a podcast. We do live meetings with experts. We started in multiple myeloma, and we're now branching out to other diseases in the blood cancer space. We host a specialist directory. We have a coach software tool and mentoring program, so that facilitates mentors and coaches, or mentees and coaches. We built a fitness app to do group fitness challenges called HealthTree Moves. We created a learning management system called HealthTree University. So we tried using Teachable and Canvas and found it to be wanting for a patient community who was really older and needed single sign-on. They needed everything integrated. They needed everything really simple. We also built a clinical trial finder, a journaling app, and a social media network, kind of like Smart Patients or My Health Teams. So everything is bundled together. It's all integrated. And then because we have so many touch points for these patients over the lifetime, really, of them with their disease, and we're supporting them in other ways. And we have traditional things like, patient navigators and things like that. But because we have such high touch with the patients, we can then invite them to accelerate research. So we built a product called HealthTree Cure Hub. It's a patient data portal. It facilitates patient data contributions. They can perform surveys and studies. And in multiple myeloma, it's the most comprehensive and most continuing as well. It's not just a one and done data registry that's just a slice of time. It's longitudinal data from the time that patient was diagnosed. So here's a little bit more about how we use these data solutions to help identify faster cures. This is the type of data that we're gathering. Some of it is patient generated. We're pulling from multiple EHRs, and we're also inviting patients to contribute data that may or may not be in the EHR, like patient reported outcome data following therapy. Because really, if you don't have patient reported outcome data, you can never use AI because you're always open loop. We validate all this data with the medical team, and sometimes we are pulling it from the EHR via Epic or Cerner or VA system APIs. And sometimes we're actually requesting a paper record, which is not that fun for anybody, but sometimes it has to happen to have a completed profile for the patient. And then we have this data entry process where we have the patient contributed data and paper records. We have patients sign a consent. They're essentially opting out of HIPAA to be able to share their data with their peers in the disease space. And they do this because we built the community programs and they trust us. We have spent over a decade building trust with this patient community. They know that we're a nonprofit. So interestingly, we did this in a nonprofit just because of that reason. A lot of organizations have tried to do this before and they lack the patient trust. So that piece was absolutely essential. And then basically HealthTree Cure Hub is this living registry with longitudinal data. And because we have those frequent touch points with patients, we are in constant contact. We will run a survey or a study and we'll say, hey, Dr. So-and-so wants to know this about multiple myeloma. What does a cure mean to you? And we were able to recruit 1,500 patients in less than 4 weeks, compile the data, turn it back around to the investigator for free. And then he went off and published on that data. So some opportunities we've worked with investigators. We have some projects going at Memorial Sloan Kettering. They're in New York with you, and many other myeloma centers, major academic centers, to identify different research questions that these doctors want to answer with trials that really are never going to be funded by industry. But we have started working with industry as well because we have valuable data that we now have over 11,000 participants in HealthTree Cure Hub, and we have a subset of those that have fully validated profiles. So that means everything. That means labs, genetics, imaging, prior lines of therapy, and then the patient themselves, like I said before, adds their patient-reported outcome data and other type of data. So this is the type of thing that we can do now. We can provide early R&D support for asset development. We can bring together small focus groups or do surveys or studies about the patient perspective. We can help with clinical trial support or confirmatory data support. We've done some case matching in these synthetic control arms, and now real world data is becoming a more valued, I think, source of data. I think 10 years ago, had you asked about real world evidence, it would have been kind of, mocked or whatnot, but it's becoming a nice complement to clinical trial data. We can provide real world evidence, this real world data, patient reported outcomes, and we can facilitate surveys or studies. And we can do near to market support like marketing materials and things like that, or marketing review because we have this patient community already built. Interestingly, it allows us to do additional work on diverse populations as well and invite them to participate. We have several programs that are multiple myeloma is found more frequently in the African American community. And the FDA is really focusing on kind of mandating additional diversity inside of clinical trials. So we're trying to help with that there. And in addition, so like I said, we've been doing this in multiple myeloma for over 10 years now. And we have very well-established programs. Our support programs really reach about over 1 million users, unique visitors to our programs in aggregate on an annual basis. And in multiple myeloma, there are about 150,000 living myeloma patients. So we are reaching that population plus family, friends, caregivers, some of the medical community. And now because we have this toolkit that we can pick up, customize, and drop into other diseases, we have stood up divisions in acute myeloid leukemia and MDS. We're launching one in CLL, most likely in follicular lymphoma. We probably will start with the blood cancers, but we could reasonably start other diseases. And when we did kind of a 50-city tour to identify what patients wanted out of HealthTree Cure Hub. And on that tour, we met with over 850 patients in a live way. So we kind of followed this. My husband wrote a book called Nail It, Then Scale It. We followed that Nail It, Then Scale It methodology. Instead of building something that nobody wants, we showed and co-developed it really with patients to see how best to do this and how they would be willing and how we could be trustworthy to facilitate that type of research. Future opportunities really are the possibility of creating a biobank in conjunction with the real world evidence data that we have. We're considering that. We are building a tool called, or a company, we're doing like an affiliate company called HealthTree MD to now also do like a clinical decision support tool. We're talking to diagnostic companies in terms of partnerships. And we're really doing things that patient advocate groups don't typically do, but we have the tool set to do them. And we are very excited about what we've been able to build. And every time people see what we have to offer, they are really blown away by it. So the last is just our URL at healthtree.org.